Hi there, and welcome to Wow Talk. My name is Donna Cappuccitti.
My name is Dr. Darlene Gustin, naturopathic doctor.
And today we are going to talk about making difficult medical decisions.
Absolutely. I have a lot of patients who seek advice from me looking for somebody else to make the decision for them. Do you think I should? Do you think I should remove my gallbladder because I have stones? Do you think I should have chemotherapy? Do you think I should surgically remove this body part? Do you think I should have a vaccination for my children or for COVID? So it's a very common conversation with a naturopath because we're the alternate. We're the alternative medicine, and they want to hear the other side of the fence.
Yeah, and I fall right into that category. I have asked you a number of things.
Absolutely.
In fact, I was just talking to you just before we started recording. Should I get the vaccine? And I'm talking about the COVID vaccine.
The vaccine. I'm getting so many messages on my phone and emails and appointments, and I'm just flooded with that these days, and I can't answer that for you. Ultimately, with a decision like that, it's your own personal body. It should be your decision, and it's not like one decision fits all. We're very grateful and blessed that we have that option, and you have to balance a lot of variables. What is your state of health? What is your amount of exposure? Are you comfortable with how much science you know about that decision? So I find that when you're fluctuating and trying to make these big decisions, my recommendation to patients, regardless of what that decision is about, is you need more information. And I will share everything I know as a naturopathic doctor about their situation. And it's my job to assess their state of health so that whether they get a vaccination or not, or vaccinate their child or not, or remove an organ or a body part, or choose prescription medications or supplements, that's not my decision. My job is to add to your understanding of your state of health so that you can make the decision for your body. Because science isn't black and white, medicine isn't black or white, whether you're a medical doctor or a naturopath. And pharmacists know medications come with side effects, but they also do good things for people. And the same is true for supplements and herbs and diets. There's people that it works for and people that it doesn't work for. And the way you match yourself up with the right health decisions is by knowing more about who you are. Are you inflamed? Are you a person that has risk factors? So for instance, with the vaccine choice of the day, there are risk factors. So the science at this point knows that certain people who are diabetic or have obesity or high blood pressure, whether they contract a viral infection or become injected with something, that there's a greater chance those people would have complications.
Okay, and you were also mentioning something that I found really interesting and fascinating, and that is also the state of mind that the patient is in. Could you elaborate on that?
Absolutely. So the longer I've been in practice, the greater weight I put on the patient's mindset and emotional health. So many of my cancer patients, when they first come, are in a great state of fear and confusion and overwhelm. And I try to just calm them down so that they can breathe again and get their power back. And I give a lot of handouts and literature and tell them to go read this and read that and help them understand what they're reading. But what I've experienced over 30 years in practice is that the patients who have the determination and the mindset and the responsibility that they accept for their own health, they excel. They do very well. And so I tell them, it doesn't matter to me if you take choice A or choice B. What matters to me is that you feel that you are fully informed and feel really good that that is the right decision for you. And even if it's different from what I would choose for my body, I see the best possible outcome when you feel good about what you're doing for your health decisions.
That makes perfect sense. And it also reminds me of my mother, if you could believe it. She sometimes would say, you can be your best doctor. Back to what you're saying, because we do know our bodies and we know what feels normal to us. And when things are off, we're the only ones who know because we're the ones who are feeling it. Now, a doctor, of course, would be the authority or the educated person to actually diagnose and let us know what's going on. But it's really up to us to know if there's something that seems to be off. And also our gut. I guess that's back to what you're saying about the mindset. And I'll just talk about my own experience and how I used my gut and what I was feeling and what I knew what was best for me. And that happened, as you know, when I was going through breast cancer. So it was recommended to me, and this is what I found so interesting, because as much as our doctors do know a lot and they are educated, sometimes it's a best guess as well. And why I want to say that is I did an MRI. I did all the tests ahead of time. And it looked like at the time, my breast was infected and not the lymph nodes, as you may recall. So my doctor at the time, who was very, very good, the breast surgeon, she had said to me, if I was to make the decision to have a mastectomy, I would most likely, actually, she made it sound almost very convincing that I would only need radiation and no chemo because there wasn't any sign of cancer in any of the lymph nodes. But there was something that was just in my gut. I kept feeling like, no, I didn't want to remove the whole breast. There was just something nagging me. And I felt I would be comfortable with a lumpectomy. And I think you would understand too, I almost felt like I was going to be removing what is a body part, almost like taking a limb off. And I didn't feel right about it. And so my words were, I want to do the one surgery, see if they get clean margins. If there was any reason to go back in and then remove the entire breast, then I would make that decision at a later date. Anyway, as it turns out, they did do the lumpectomy. They did get all the cells. They got clean margins. And they discovered that 6 out of 12 lymph nodes that they removed did in fact have cancer. So, having said that, I would have needed chemotherapy anyway, even after removing the breast. So for me, I think that it would have done more harm to me mentally and emotionally, and it would have been a downward spiral for me, fighting through the cancer had I removed my breast, because I would have been mortified knowing that I took it off when I really didn't need to. And so I often think of the day of that surgery as the day I saved my breast.
Absolutely.
And it really gave me, I felt positive about it, and I was strong. And I do need to say one other thing. The whole time leading up to that surgery, because it was a few months in the making, because we had to coordinate both my breast surgeon and a plastic surgeon at the same time, because she was going to rearrange tissue so I could keep the breast and keep everything intact. Anyway, I kept saying to my doctor, by the time you get in there's going to be nothing left, because I'm working on shrinking this tumor. And I was so convinced I was doing it. And I will tell you, it did go from 5.3 centimeters or 5.2 maybe down to 3.8. So I really did do my work, and it was going in the right direction. So I think that had a lot to do with it too, just because of what I was doing, the choices I was making, the way I was trying to starve the cancer, so to speak, and my clean eating and everything. So there you go. So there's an answer of
awesome,
when it all works.
Yay. I know it's so exciting to hear these stories. And when I first started in practice, it was something I was very quiet about. Certainly in a group of naturopaths, we always believed in the body-mind connection. We defined health as body, mind, and spirit, but we didn't actively practice. I didn't actively practice stepping into those those kind of conversations because it was a new profession and I had to stay very conservative and only talk about zinc and protein. But there's now a new field in medicine. So for the listeners out there, I suggest you Google this word, psychoneuroimmunology. It's a new field in medicine, and it's basically the body-mind connection and how the immune system is influenced and how interconnected they are. So it always was like this, just the science was a little late confirming and describing it. And it's so exciting because at this point, the body of knowledge has admitted, proven, and accepted that every single cell in your body has memory and they all talk to each other. So as you were telling your story, my brain is thinking every single cell in Donna's body was saying no to that surgery. And you knew that gut reaction is not just a phrase, it's proven science. And back to another talk that we had, that your brain is not the one making the decision. Your brain is ruled by the microbes in your gut. They make all the neurotransmitters. So the gut reaction and those gut feelings is a real thing.
Oh, yes, I believe that because every time I go against my gut, I regret it. I swear to you.
Absolutely.
Probably 99.9% of the time.
Definitely.
Yeah.
So hopefully your story inspires the readers because it's a real person. And the other thing I wanted to mention is that medicine is an art and a science. It's not black and white. Every doctor in every profession will find themselves working on a rare, unique case where I have to just connect the dots for you and try something new that nobody's studied yet. And every patient is an individual. And every doctor is a human.
Yes. Very good point.
So far, anyway.
Yes. Oh my gosh. That's a whole other topic.
Yeah. So it's not a perfect world. So these decisions should really be a team decision. That I tell my patients, pick the brains of everybody on your team. Create a team. I'm only one of the people on their team. They might have a surgeon, a radiologist, an immunologist, a mother, a relative who's had the same diagnosis, a pastor. It doesn't matter. Create your power team, pick everybody's brain, and then make your decision when your gut reaction kicks in and just go for it.
Great advice. I love that idea of a team. Mm-hmm. And one other thing I would add is a second opinion is always very valuable.
Absolutely.
Yeah. And I can attest to that too, but we'll talk about that when we talk about breast health.
Yes.
But on that note, thank you so much, Dr. Gustin. This was a very interesting topic, and we would love to hear from you listeners as well. Please let us know what you think of this. If you have any questions, we'll tell you what to do. Just kidding. We won't.
You say yes, I say no.
Okay. Anyway, thank you for listening. Bye for now.
Thank you. Bye.